Hans-Jörg settles into his room at Innsbruck Provincial Hospital before he has an operation to remove tumours from his liver the next day. The 75-year-old has cancer. Initially bowel cancer, but it has now spread to the liver. Chemotherapy was unsuccessful. Jörg heard about a novel method of tumour removal offered at the hospital in Innsbruck. His last hope is the team led by Rito Bala, an interventional oncologist who's made advances in radiofrequency ablation treatment, a procedure used all over the world by employing a puncture technique that incorporates 3D navigation technology. It is called stereotactic radiofrequency ablation and uses heat to destroy tumours with pinpoint accuracy.
Dabei werden Nadeln sehr präzise in den Tumor eingebracht und
we place needles inside the tumour extremely precisely to guide radiofrequency probes, which are then heated by passing current through them. This destroys the tumour, burning it from within, which, in principle, allows us to target any point in the body for tumour and pain treatment with great precision.
Jeden Punkt im Körper sehr präzise ansteuern und hier Tumortherapie, aber auch Schmerztherapie durchführen.
Before applying the current, the positioning is checked with a CT scanner. The tumour tissue around the tip of the needle reaches temperatures of between 60 and 100 degrees and is destroyed.
Die Radiofrequenzablation ist eine Standardtherapie auf der ganzen Welt, in sehr vielen Häusern.
Radiofrequency ablation is an internationally established standard treatment method. The difference with our technique is that normally only one and a maximum of 3 needles are used, meaning you can only treat tumours measuring 2 to 3 centimetres. With our method, we can use a lot of needles to deal with large tumours. The biggest tumour that we've comprehensively treated was 18 centimetres.
Und damit sehr große Tumore mit diesen Ablationsarealen abdecken.
And that there has been no damage to the surrounding blood vessels. Rito Bale has successfully treated over 900 patients with his unique method, who, just like Hans-Jörg, were able to return home from the hospital in Innsbruck between 1 and 4 days later.
Organ malignancies have the potential to be ablated.
Ultrasound, it is real-time, portable imaging, and also the ability to use those same waves to do therapies. And it's almost too incredible, right? It's totally safe for imaging babies, yet it can do brain surgery and destroy a tumor right through the skull.
We're also interested in newer applications for use of focused ultrasound, and one of the things that we're interested in is the treatment of things like cancer, brain tumors, and epilepsy. Currently, one of the major treatments we
the need for an operation or chemotherapy. Jeremy Stern reports.
Just days after potentially life-saving treatment for kidney cancer, David Atwell was feeling fit and healthy.
Certainly it didn't hurt me at the time because I was under, nor did it hurt shortly afterwards, the following day. I don't really think I had any medium-term results that were adverse.
David opted for a relatively new kind of cancer treatment at the Churchill Hospital in Oxford.
If I was to say ultrasound, you may well think of images of unborn babies. This machine uses the same kind of technology, but it's 10,000 times more powerful. It sends out sound beams which pass through the body and destroy cancerous cells.
We have great pleasure in declaring this unit open.
Today, Chinese doctors were invited to the Churchill's new ultrasound unit. The machine's been loaned by the medical authorities in the Far East.
Breast cancer, prostate cancer, stomach cancer, lung cancer, pancreatic cancer, mesothelioma cancer. We have equipment to administer non-invasive procedures such as SPDT, RFA, radiofrequency ablation, high-intensity focused ultrasound, HIFU, and alternative cancer.
In the facility. We are one of the few who have the motivation to actually make a difference in the field of cancer treatment.
breast cancer patients.
We found very little in the way of side effects. There was some fatigue, there were no skin burns, there was very little swelling, there was no injury to the chest wall or the lung or the underlying heart.
Here's how it works. Breast surgeons place gold markers in the area where the tumor is taken out. CyberKnife delivers radiation within those small margins.
It can track motion, so you can focus it on an area of interest and it will treat that within just 1 to 2 millimeter accuracy.
Doing the CyberKnife, I mean, it was fantastic.
The level of accuracy on this system is extremely accurate. It's sub-millimeter accuracy. We can see at a whole different level exactly what we're doing.
It's a healing from the moment that you walk in and you feel that. You know that you're in the right place.
If you feel loved, if you feel comfort, if you feel like there's...
Normally, during the course of your CyberKnife treatment, the robot follows the tumor as it moves, delivers radiation to the tumor, and avoids spreading radiation to the surrounding healthy tissue. Combined with Accuray's Excite lung technology, doctors are often able to treat lung tumors with